As the second wave of COVID-19 sweeps through the country with deadly consequences, critical care experts, doctors have started advocating pruning exercise to improve oxygen levels in COVID-19 patients, both in isolation as well as in hospitals. Medical experts say that prune improves breathing comfort and oxygenation that is extremely beneficial for COVID-19 patients with compromised breathing, especially during home isolation. Dr. Bruce Kirenga, the head of Lung Institute, explains what prune means.
People who have COVID should endeavor to sleep on their stomach. Our lungs are made of air sacs. Now, when you sleep on your back, the air sacs at the back collapse. The ones at the top distend. Now, these air sacs, the alveolars, they're actually like balloons, living balloons. When it is too distended, it won't work. When it is collapsed, it won't work. So we have found actually that if you sleep on your stomach, especially when you put a pillow, lower part of the chest and maybe the pelvis, open up the air sacs at the back which had collapsed. But the ones which were already over distended at the front, they now collapse a bit and you balance and you oxygenate better.
Dennis Butera, critical care expert at Mulago Intensive Care Unit, demonstrates how pruning position is done, especially for COVID-19 patients at home.
You do your legs like this, you bend down. The idea of this is most of our lung is down. The bigger part of our lung is down. And that's where the virus will go and attack. It begins to attack down, come upward. Now, lie down like this. Is that okay? That is the position one can attain at home. Or the other hand can be like this with the pillow with support. You sleep in this position. But this position may not be comfortable with people who are obese.
Medically, doctors suggest that a patient remain prone for minimum of 30 minutes to the maximum of 2 hours. This helps improve ventilation to the lungs, hence oxygen levels start improving.
You can take a routine. 2 hours on your stomach, 1 hour left, we call it left lateral, okay? Now you have the comfort, your default 2 hours on your back, 1 hour left lateral, and now come back. Now you can do the mathematics. How many hours will you have on your stomach? I don't want to examine you. So at the end of the day, you will have several hours sleeping on your stomach and will not become boring. But what we see is, especially when people are weak, they just sleep on their back the entire day.
Experts say that the position can also be applied on children at home, especially those battling with COVID-19. Medics still appeal to the general public to strictly follow the guidelines by the Ministry of Health and also observe the standard operating procedures to curb on the spread of the deadly virus. Zahra Abigaba, UBC.